everyone, it's Dr. Jen Trachtenberg, board certified pediatrician, spokes doctor for the American Academy of Pediatrics, parenting expert, author, and mom of 3 kids as well too. And today, thanks for joining me on What's Up Wednesday, really discussing coping with your crying baby. And I just thought this was a really excellent topic because babies cry a lot. And sometimes, especially as new parents, new moms, it's sort of overwhelming, right? You're really tired, it's really stressful, all your hormones are out of whack, and you have this baby that's crying all the time, and you're getting told by people that everything is so wonderful and this is a great time and experience for you, and yet you have this baby that's crying and crying, and it's absolutely normal to feel anxious and to feel overwhelmed. But I'm here today to give you lots of tips and advice about crying, particularly in the newborn period, what you can do to help the baby, but also what you can do to help yourself, because we know that that balance is important. Helping yourself and feeling good will also make for a happy baby too. And it can be really stressful because you don't know what's wrong with the baby. Are they sick? Or they just need to be changed? They need to be held? Is something else really wrong? So I'm going to give you all that information. So keep on listening to learn not only why your baby may be crying, what's typical and normal, what you can do to help, but also what you can do to help yourself as well too. I've got a lot of great tips for all those moms out there too. So let's begin. Actually, I'm going to bust a myth first. The things I know, I see, and I look out on the internet all the time is that I read that you're supposed to know your baby's cry. They have all these different cries at birth. Well, you know what? They really don't. It's very overwhelming. Babies cry. They cry to communicate. It's shrill. It's loud. And you just don't know what to do. So what I tell patients right from the beginning is to sort of have a routine or a plan. So if the baby is crying, you may not know what it is, but if the baby's crying, you pick up the baby. And we're talking about babies within the first 3 months of life. And I'm going to talk about them. I call that the 4th trimester. We're going to talk about that a little more. But in the first 3 months of life, so the baby's crying, you pick the baby up, and you sort of just have to see, you can check, do they just need to be held? Sometimes changing positions makes them happy. They're looking a different direction. They're seeing the world from another angle. That may be happy. Are they overtired? Another reason why babies cry. So we'll talk about that and what to do. Are they wet? Did they poop? Did they pee? Do they need their diaper changed? So that's another thing to check also. Do they just need to suck? So babies, especially within the first 3 months, they have a normal reflex to suck. And so they may want to suck on your finger, or a pacifier is fine too. It's just a normal reflex that actually decreases and pretty much almost goes away. They don't have that strong reflex anymore after 3 to 4 months. So do they just want to suck? And of course, are they hungry, right? So newborn babies need to eat very frequently. Breastfed maybe 2 to 3 hours, formula fed every 3 to 4 hours. I don't like to put babies on a strict schedule because no one wants to eat exactly to the clock on the hour. So if they seem hungry and they haven't eaten in a while, yes, it's fine to feed them, specifically those first 3 months too. No bad habits are going to be formed. So when you are talking about a newborn baby, you want to make sure when they're crying that right away you pick them up, and you can try different means, but try it in an order. And I think if you do it sequentially, I think that will make it a lot easier for you to figure out what's going on. So those are usually the most common reasons to start with, but your baby may be crying and crying and crying and really crying, and you're freaking out and you don't know what to do, and you call the pediatrician. And I get a lot of those calls. My baby's just crying, and they check, they don't have a fever, they don't have a runny nose, they're not coughing, they're just crying. And so I always take it seriously because you don't really know what's going on. So if the baby can't be soothed at all, they oftentimes need to come in for an appointment to see the pediatrician or the physician to check everything out. And I think that's really important. You can't really always handle everything over the phone. So you need to take the baby's vitals, and you need to take the baby's weight. Maybe they're being overfed, maybe they're being underfed. That can cause them to cry as well too. You want to listen to their heart, their lungs. You want to check their body from head to toe. There's even something that we doctors look out for, something called a hair tourniquet. It could be a hair or a string, really small, tiny, wrapped around a finger or a toe, and that can be really, really painful. So that is another cause of crying in a baby that doesn't stop. So it's really, really important to, again, see the pediatrician, have a full exam, get a really good history. The pediatrician will do that as well too. And you know what? Many times there isn't anything medical going on, which is great, right? You don't want your baby to be sick. But, oops, yeah, crying in the background, so you can see this is really authentic, right? So, oftentimes what I end up giving is a lot of reassurance to mom and to dad that the baby is okay, that they're healthy, and that they have what is called typical or developmental crying. And it's totally normal, but people don't talk about crying that much in the newborn period. But it happens, and it happens a lot. So I'm going to talk a little bit more about this developmental crying. And, you know, I just want to say that those first 3 months, I called it before, the fourth trimester, are really difficult time. It's sort of like the baby, I always tell mom, wasn't really ready to hatch. We have we have trimesters, but this fourth one, the first 3 months, the baby is still very immature. So they have immature immune system, immature digestive system. They can have reflux. They can be cranky. Their reflexes are stronger. They startle. They wake themselves up a lot. They can't soothe themselves. So it's a really difficult 3 months. Yes, it's great to bond and have skin to skin and to be with your baby, but it can be really stressful as well. Particularly, as I said, new moms who are tired, they're overworked, they have, you know, your hormones are raging, you may be breastfeeding or bottle feeding or both, just the combination of everything. They may have other children as well too, or it's just your first time, and so everything seems overwhelming, and again, the sleep deprivation can really get to you. So this first 3 months when babies can't self-soothe can be really challenging, particularly if they're crying a lot. And as I said, this crying is often called developmental crying because it is normal, that there really is nothing wrong, but it's a lot of sustained crying. There's this acronym called PURPLE. It's just a good way that I can explain to parents what happens with this first 3 months crying. And I get to tell them that it does get better. I often do laugh because I see then mom or dads who come in with the second baby and it's all over again. They ask the same questions and they're like, I totally forgot that, you know, my baby was crying so much the first time around. And I said, yep, you know, so it sort of gets erased from your memory, which is a great thing. But those first 3 months can be very challenging with the crying. So let's get back to PURPLE. So the first P in PURPLE is, P stands for peak. I just love it that this child in my office is crying because I think it really, as I say here, I get so much crying, and parents have to deal with it. So I really want to help you cope. So getting back to P. P is peak. So the peak time for crying is usually, it starts about 2 weeks, and then about 2 months is really that peak when they're really fussy, crying the most, and then 3 to 5 months it really decreases dramatically after that 3 months. But if you think about it, so the first 2 weeks, right, so baby just gets home, and that's often when you have a lot of help, right? Your spouse may be there, they may not have gotten back to work yet. You may have grandparents, a babysitter, a nanny, a nurse, what have you. And then they usually leave after 2 weeks, maybe 3 weeks, and that's when the baby starts crying a lot more. And again, that's physiologic, it's normal, but it's very overwhelming. Parents often say to me, oh, they changed so much, you know, they used to be so happy, and now they're just so different. And, you know, this is typical of what happens. So babies don't stay exactly the same. It changes from week to week. And yes, the crying gets more intense and longer, specifically after 2 weeks, but really is that peak breaking point at like 2 months of age. So P is for peak crying. U is unexpected. So this crying, again, I get calls from parents all the time. They just started crying out of the blue. And so that really freaks parents out. But that's, again, really common too, that babies at this age, they just start crying out of the blue. They're fine. Again, they take the temperature and everything seems normal. It was just really unexpected. They try what I'm going to talk about, methods of soothing, and sometimes that really helps. But it can be very unexpected. It doesn't necessarily mean that something is really wrong. So the second letter U is for unexpected. R is resist soothing. So this is really difficult for parents and needs a lot of reassuring. So it seems like you've tried everything. No matter what you do, the baby's crying and crying and crying. And that's when I get those calls. Oh, something has to be wrong. There's nothing I can do to soothe the baby. And I have to take it, obviously, always seriously because you don't know. But that is very common and that can be very stressful. So we've got to talk specifically about what to do when your baby is really resisting soothing. What you can do to help yourself as well as the baby too. The next P is for pain-like. pain-like face. So I get that all the time too. Parents tell me, oh, the baby seems like they're in so much pain. They're making a face, they're grimacing, they're seeming like they're in so much pain. Again, but when I examine them or they come to the office, they seem fine by then. And that's what they do. So that's a very common facial expression that babies make in the newborn period. When they're crying, they can turn red. By 2 months, they're having tears, and that makes it even worse too. They seem even more upset. But they have, we call it a pain-like expression, even though that they really aren't in pain. You examine them from head to toe, and there really is nothing wrong. Again, it can be really, really stressful, though, for new parents. L is long-lasting. So this is also hard because the baby can be crying for hours, really even up to 5 hours. And, 5 minutes seems a lot when it's a baby. So if you have a baby that's crying all day long, specifically if it's night when you're tired and you just want to sleep, and you're at your wit's end, it can be exhausting and really upsetting and very anxiety producing. But again, that's part of the normal developmental crying that does occur with babies as well too. And the last is E, and that stands for evening. So babies often have more crying in the evening. And again, I'm not even talking about that the subset of babies that are colicky. These are just in general. Parents don't talk about it that much. Everyone always thinks when they come to see me, they're like, well, my baby's crying so much, and my friend, this baby doesn't cry, and this baby doesn't cry. But I'm telling you, I'm the one as the pediatrician who sees them all the time, and I'm telling parents all the time and reassuring them it's not just your baby. You see things and you see pictures on Instagram and on social media, and the babies always look happy. But I'm telling you, everyone's baby, specifically those first 3 months, are not happy all the time. So evening is the sort of more of a witching hour when babies are much more cranky than during the day. So what can you do we talked about soothing these babies that are crying, this developmental crying. And you really have to soothe the baby. So babies can't self-soothe the first 3 months. You can't have bad habits. They need to be picked up. They need to be held. If they're calm and stuff, you can put them down again. But babies can't just soothe themselves the first few months. So it's okay. Those old wives' tales that you can't pick them up, that you're not to leave them crying, is not true. You want to help them. So there are many different things that you can do. The first off is swaddling. And I'm a big fan of swaddling. Many pediatricians are, because it does work. But you have to do it appropriately and correctly. So there's all these different swaddle blankets. You can swaddle them yourself. You want to make sure that it's not too tight around the legs and the hips, that they're not too tight, that they can have some wiggle room. And you also want to put their hands, when they're young, newborns, in, their arms down. So they're sort of like a burrito. If you put them out, their arms are just going to flail, and that's just going to make them cry more, because as I said, they have these immature reflexes that make them startle a lot more. So you want to put their arms in, and the swaddling at the young age can be very, very helpful. Picking them up and holding them, even on their side, or putting them on their belly against your hand. Laying them on their belly can be very helpful too. Laying them across your lap on their belly can be very careful. Doing that as well. Again, you don't want them sleeping on those positions. You want them only sleeping on their back as newborns, as babies. But you want to, those positions can be very, very helpful in soothing a baby, holding them in a flying position, up in the air. Again, you can rock them, but you won't rock them obviously too vigorously. There, you can take them for a ride in a carriage, a stroller, a car. Sometimes that's helpful. But yeah, vibration and movement can be very helpful. So that now there's all these bouncy seats and rockers and things like that have vibration and movement. So again, that little vibration can be really, really helpful, or movement in calming a crying baby as well too. And as I said, babies have a very strong reflex to suck. So even, washing your hands and putting your finger in their mouth can be very helpful. Sucking on a pacifier. You can't force a baby to take a pacifier, but you can try different ones and see if there's one that they like, and that can be really helpful. Again, you don't need to use it all the time, but just at these times of high intensity crying can be very, very helpful too. And then they lose this reflex after about 3 months or so. So if you see they're really spitting out and they don't want it, then it's fine not to continue to give it. Each baby is different, and you have to try different pacifiers to see what works best for your baby. Shushing or white noise is really helpful too. So what is white noise? Well, it's things like the vacuum cleaner or the washing machine, fans. That sort of background noise can be very helpful in soothing a baby too. And now, of course, there's many different apps, right, that have all these different white noises. that you can play, and that again is really, really helpful for calming babies sometimes. You can try lullabies and other music, but this white background noise seems to be really, really helpful when it comes to newborn babies and crying. So you can try that too. And so those are, and then obviously, sometimes it's that the baby needs to be fed. It wouldn't be my first choice. It would be these other things first, but oftentimes feeding may do the trick as well too if the baby hasn't eaten for a while. Again, don't be a clock watcher, and if it's 15 minutes before and the baby is crying, crying is a late sign of hunger. So if they're crying, it may be that they're hungry. So make sure to feed the baby. That's always appropriate if needed. So the other thing that I want to tell you is that even though the baby is crying, you have to try as much as you can not to be so stressed or anxious, particularly if you know from the doctor that it is developmental crying, that they're okay. When you're anxious, then the baby can be anxious too and more upset. So try to stay calm. If you need help, it's totally fine to ask for help as well too. Take some time for yourself. That's really, really important. So some tips for all those new moms who are listening today is that you have to remember what your doctor says. When they reassure you it's not your fault, it's definitely not your fault. Babies cry, and they can cry a lot. And I know it's hard to grasp that it's not your fault, but it does happen. So you want to make sure that you give yourself a lot of time as well too. This is not the time, the first 3 months, that you have to make sure that your house is so clean, that you've emptied the dishwasher, that you wrote your thank you notes or sent emails back, or even send out a zillion pictures. You are there to be with the baby, to take care of yourself and to take care of the baby. If the baby is peeing and pooping and sleeping, you're able to bathe the baby, keep them clean and warm and dressed. You're doing an amazing job, mamas out there. It's so hard to even get that done. And people just don't know. They just, you think about the beauty of the baby, and everyone's telling you how wonderful it is, but there's another whole part of it that's really, really difficult. And I think it's important for parents to know that, because if you know that, and then you have these tools to help you with the crying baby, you're just going to feel much more confident. It will help to decrease the anxiety, and knowing that by 3 months this really, really decreases tremendously. I think what else you can do for help is if you have friends and family over, or they ask what they can do, be specific with them. Give them specific things that can be helpful. Don't say, oh no, that's okay, but have them come over, and if they come over, say, can you hold the baby for an hour for me? I don't mind at all. Make sure they wash their hands, but can they hold the baby? Maybe you can either lay down in the other room, because they always want to see the baby more than they want to see you anyway. Have a cup of tea, or even take a bath or a shower. Or a few minutes to yourself can really make all the difference in the world. So if a friend comes over, tell them specifically. Maybe they can even bring you dinner. That's like one less thing you have to do. Or maybe they'll even fold a load of laundry for you. All these things can be so helpful for a new mom. And another tip is when it comes to your spouse. So, your spouse obviously is there to help you as well too. So I think one of the things that's really important is not to micromanage. They are there to help. They may not do everything exactly the same, but they can certainly be helpful. And it's okay if you do something one way, and they hold the baby a different way, but that works too. Or if they're holding the baby and the baby's still crying, it might still be crying if you're holding the baby too. So try not to butt in. Try to take that time for yourself as well too. You'll have plenty of time to be with the baby, but let them get used to it and get into their own routine with the baby too. It'll take pressure off of you. They'll be able to bond with the baby as well too, and it'll be nice for the baby. So try not to micromanage your partner. You should definitely be on the same page. But it could be a time for you to have a little bit of relaxation for yourself. That's well needed as well too. And lastly, I'm just going to say that this 4th trimester that I spoke about, those first 3 months after birth, it will pass too. It's a very hard time. It's a beautiful time where the baby grows and changes, comes from this little baby that you're holding all the time that you need to help soothe, is starting to then be able to be on a routine and soothe themselves and put themselves to sleep even. But it's really hard. And again, I think as a pediatrician, it's important for parents to know that, not to sugarcoat it, because this way they'll be prepared. And that's what I want to do, give you the information and prepare you, make it fun, but let you know that there are resources out there like your pediatrician. And this also is the time when baby blues occur too, and that can make things really difficult. even postpartum depression, when you feel that you are just so overwhelmed that you don't want to be with the baby, that you don't even, can't feed the baby, you can't look at the baby, you can't even get out of bed, nothing is making you happy. It's important to speak to someone, and it's important to speak to a professional. So if your pediatrician or your OB doesn't bring it up with them. It's okay. Many people feel this way, and you can get the therapy or the help that you need, and the support from professionals as well as family members to get you through whatever is needed during this first newborn period. So crying occurs a lot. It can occur frequently. I think it's all about knowing how to manage it, knowing when you have to worry. Definitely have conversations with your pediatrician if you have concerns. Let other people help, and knowing that crying is normal. It's a normal developmental stage that babies go through, particularly in the first 3 months. So this is Dr. Jen. I hope that I was able to help, giving you lots of tips, evidence, and information to help balance that hard time during the first 3 months when baby is crying a lot. So if you have any questions or comments, just leave them below. I'll certainly get back to you and answer them, and hope you have a great rest of your day.